Cabinet was briefed on the temporary suspension of the Johnson & Johnson Sisonke vaccination program, which was a precautionary measure which allowed South Africa's scientists to review the South African data on the J&J vaccine. This followed the suspension of J&J vaccination rollout program in the United States of America after 6 people who received the J&J vaccine developed a red type of blood clot. And also, it followed the temporary suspension that was done by Johnson & Johnson itself, the voluntary suspension, to roll out their vaccine in the Eurozone. The temporary suspension in South Africa was in line with government's commitment to ensure that comprehensive safety measures are undertaken regarding the vaccine rollout. The reviewed data had confirmed that South Africa had not experienced any rare blood clots with the already vaccinated health workers. Cabinet welcomed the recommendation of the South African Health Products Regulatory Authority to lift the suspension of the J&J Sisonke vaccination program. Our scientists will continue to monitor all South Africans as and when they are vaccinated. By mid-April 2021, more than 295,623 health workers had been vaccinated under the Sisonke vaccination program. And also, Cabinet was briefed on the vaccination rollout program, and Cabinet welcomed the progress in the signing of the contract with J&J on the procurement of the J&J vaccines for the full rollout program, which will commence on the 17th of May, and we're still on track for that commencement, and commended the Minister of Health, Dr. Zwelini Mkhize, and the Minister of Trade and Industry and Competition, Mr. Ibrahim Patel, for resolving the outstanding matters related to the procurement of the vaccines without compromising the position of South Africa. Furthermore, Cabinet welcomed the successful negotiation of an additional 10 million doses of the Pfizer vaccine, which brings the total doses of Pfizer vaccines to 30 million. This means South Africa will be able to vaccinate 15 million people with the Pfizer vaccine instead of just 10 million that we had initially planned.